Welcome to Tehachapi. Sit back and relax as Key Budge and Corey Costello talk about things that are happening in and around Tehachapi. Here's Corey and Key.
Welcome to another episode of Tehachapi. Today we're going to talk to Josh Pierce. He's the manager of training and development for Adventist Health Tehachapi Valley. With me today, Corey Costello. That's going to be a good conversation.
Yeah, with COVID-19 testing continuing and now the rollout of the vaccine and some of the logistical concerns and things like that. So there's a lot going on, not just call up, give me my shot. There's a lot of stuff happening. So he's going to really open that up for us and let us know what the process is.
So if you have questions about, the vaccinations or testing and things at Adventist Health Tehachapi Valley, I think we're going to cover a lot of that. So stay tuned for that. But before we get to that conversation with Josh, we had a recent council meeting, Corey.
Yeah, first one of 2021. A couple of major highlights on that to talk about. I presented an update to the current multi-jurisdictional hazard mitigation plan. Every 5 years that's due. There was the County Department of Emergency Services, in which we're involved with, got a grant from FEMA, and to update the plan with all 11 jurisdictions that decided to participate as well. And so the city of Tehachapi has our own sort of annex, our own plan. And what that really is, it's kind of a fancy way of saying, emergency preparedness plan for the most part. We identified hazards ahead of time. So we went back and we updated the plan from several years ago. We had some projects that we mitigated, some storm drain issues, some power backups at key facilities, and we handled those. And so we took those off the plan and we added certain things. There was a risk matrix involved and a consultant who really helped out. So it was a really cool deal. And so we needed to get adopted by the council. So FEMA will then finally adopt it. They adopted it in principle and said, once your council blesses it, you're now eligible to fund some of these projects. So it was things like drought mitigation, which is a big thing in this area. And our groundwater sustainability project was one of the top mitigation measures. So, maybe that'll qualify for federal funding. And then earthquake preparedness. So whether it's public information campaigns and same with severe weather and that sort of stuff. So it was a good plan to get that updated, and the council did approve that. We also awarded a contract to R.C. Becker for a paving and enhanced pedestrian crosswalks. So it was just another grant-funded project, so no city match. And this will enhance the crossings in front of Tompkins Elementary with lights and flashing lights and some more push buttons for kids or just regular pedestrians in front of school. And then also at Valley and Mill. Very active crossing area. It doesn't have a crossing now, so it's not a stop sign, but it will be, obviously, when there's a pedestrian crosswalk there, there'll be some flashing lights to let you know to stop for pedestrians. So just a safety measure, and so those were two of the big items discussed and approved by the council in our first meeting in 2021. So both good projects that were grant funded.
And there was an acknowledgement, too.
Mm-hmm. Yeah.
For our past mayor, Susan Wiggins. And I thought that was a very nice, and I really appreciated getting to work with former Mayor Wiggins over the last couple of years, looking forward to what we'll do with Mayor Smith. I got a chance to take a photo of her with a nice presentation, award that was presented to her from, was it from the council?
Yeah, from the council. It was a recognition in her time as mayor. And the mayor serves a 2-year term, but, Susan Wiggins actually served him a little bit more than that because the passing of former Mayor Ed Grimes, she was mayor pro temp at the time, so she took over the mayoral duties. So she basically got 3 years and change of being mayor before she was actually made mayor 2 years ago after the 2018 election. So, yeah, she'd served for quite a while, and even before Ed Grimes had passed, she was serving in that role because he was unable, because of his health, to do a lot of the mayoral duties. So really, it seems like it's been 4 years almost, and so she did a lot of work, and it was a good recognition from her peers, and a nice job by M&M Sports to put together a really cool plaque with a gavel, and it was inscribed and everything. So she really appreciated that for sure.
Yeah. And I know Pat Duty had reached out. She's going to be following up on that, and there'll be a part in the Loop newspaper here coming up, awesome. One of the upcoming editions that they have. Today's conversation, we're focusing on COVID-19 vaccinations. Mm-hmm. And the important role that our local healthcare facilities provide.
Yeah, we're blessed to have Adventist Health Tehachapi Valley, and for a myriad of reasons, and COVID-19 sort of just brought that to focus again. How lucky we are to have not only the new hospital building, but an organization like Adventist Health operating said hospital building and improving that, and being on standby for everything that COVID-19 has presented. And now it's this opportunity for vaccination for certain people.
I think it's time to talk to Josh. We have a special guest here on Tehachapi joining Corey and myself. We have Josh Pierce, the manager of training and development for Adventist Health Tehachapi Valley. Josh, welcome to the show.
Hey, thank you, gentlemen, for having me.
We've got things to talk about. It's been a COVID-19 year. Vaccinations are starting to roll out, and Adventist Health is going to be right here in the middle of it to help the Tehachapi residents. Josh, can you tell us what's going on?
When COVID-19 first kicked off in early of 2019, our staff really stepped up along with hospital leadership to get prepared for the surge. We didn't necessarily see the surge that other areas in the country were seeing, but our hospital was still prepared, and that preparedness still stands today. We've doubled our ability to have capacity for extra patients. We're still doing emergent and urgent surgeries. We've paused our elective surgeries until the end of the month, but we'll be reevaluating it in the beginning of February if we'll be able to do elective procedures. But even during all this COVID time, we've still been able to be there for our community, and we look forward to new ways to serve. Some of the things that we've been able to do with serving, we started doing COVID-19 tests last summer. We are still doing COVID-19 drive-through testing. We're really emphasizing staying safe, staying distant, practicing all the safe things we should be doing. So we're doing drive-through COVID swabs so that you don't actually have to come inside and be around others. We are still doing COVID-19 testing on a weekly basis, Monday through Friday. And you can still call to get your test by calling 661-771-8400. On the more exciting news, we're one of the providers in East Kern County that is providing COVID-19 vaccines. So really staying within our tiers that were mandated to stay in compliance with the county and the state is our Tier 1A, which applies to all healthcare workers inside and outside of the hospital. And then we have our Tier 1B for those who are 65 and older.
I was going to say, this was set up sort of state down, right? The state sort of admitted they were behind what they wanted to do, and they decided to open the vaccine up to everybody 65 and older. I think it caught some people off guard, and you all were not really scrambling because you sort of had a plan, but you had to put something together rather quickly to start sort of meeting that Tier 1B, didn't you?
That is a good point. We were already working on plans to roll it out, but what we were told is we weren't going to be doing 65 and older. Actually, originally, 75 and older, we weren't going to be doing until sometime in February. We actually found out from the news faster than we found out from the county that we were approved to move to 65 and older. So the communication chain coming down from the state is something that Kern County has also struggled with, is that the media is finding out about the same time that we are. So there's really no preparation time to build in.
So with that, because everything is moving so fast, it's amazing we're able to kind of keep up with the way information gets released, and then you have to react to it, and your staff and the community, because we've had a year of this pressure that's going on. I don't think there's a lot of patience out there in the community. Is that translating over to your side?
Yeah, thank you for talking about that. So we're seeing about 600 calls a day are coming through for our COVID testing and COVID vaccine line. We are seeing about 300 people a day that are registering online through Kern County Public Health to get the COVID vaccine. We're definitely working 6 days a week, 12 hours a day. Our staff is working. So we're actually able to answer get calls back 7 days a week. And we just ask for your patience. I mean, our team, we're building our team. We're bringing on extra staff so we can help answer the phones and get people scheduled. We're in the process of hiring extra staff so that we can eventually go to a 7-day-a-week model of providing vaccines. We're just not there yet. In a couple of weeks, we should be in a better spot. We're also working on a program to do mobile vaccines for East Kern County. We do have a lot of underserved folks that are living in Boron, Cal City, Mojave, Rosemont that don't necessarily have the same transportation. And so we're going to bring the vaccines to them through a mobile clinic. And we are working on different plans with that in partnership with the county. And there'll be more to come on that kind of stuff.
I'll point out the patience piece a little bit too, a little bit longer, just because we're right now we're dealing with the 65 and older. You know, you're 65 and older, you're adults, right? Complaining on social media or the Adventist Health Hospital page is not going to get you the vaccine any faster. And if you're not 65 and older and not listening to this podcast, but you have somebody who's 65 and older in your family, maybe getting the vaccine, remind them that complaining on social media doesn't get you any further along in this vaccine process. It's not helpful at this point, especially because, like Josh said, 600 calls plus a day to try to fill a limited amount of spots. Like, you're in the queue. They're not going to forget about you, but obviously it's not like they're just deciding, well, I don't want to call anybody back today.
Well, it would be it would be tough to handle to live answer 600 calls.
Yeah.
Let alone the amount. Now, are those all recorded? Are those messages that you guys are trying to deal with, or do you guys answer what you can and then some go to voicemail or recorded?
Correct. So we do have people that are answering the phone when you do call. And then if you're not able to get answered in that moment, we do roll to our voicemail system. And then we have a team that comes in every day and they're going through the voicemails and they're putting you on a callback list. And that is the order that we are returning your calls in. So we do have people that are calling 6, 8, in some cases 15 times a day. Every time you call, we have to add you to the callback list. And then if we've scheduled you and you come up 4 more times on our list, we have to call you 4 more times. That's about 5 minutes lost. So we just ask for people, call once, you are on the list. We don't delete you until we call you. We do leave voicemails. We notate we left the voicemail at this time, and then we let you know how you can get a hold of us again.
And I think that's one of the main reasons why we asked you to come on is everyone out there feels this sense of urgency. Got to have it now.
Right.
There's some people that are really almost in some kind of a panic state to get it. But like you said, they create the part of the chaos that makes it much more difficult for you guys to schedule. And you've got to bring on additional staff to handle the volume of calls and the repeat calls. And then you're required to make sure you contact everyone the same amount of times they called you.
Yeah.
So, I mean, I can't imagine, it's like when I have 3 or 4 messages, it's tough to get them all back in one day, but you make sure you do it. 600.
Yeah.
I don't know.
And 200 repeats, you know, it's not very efficient. It doesn't help the process by being impatient.
And something that Kern County Public Health has pointed out a few times, this process for us is voluntary. We are under no obligation to provide the vaccines, but we're really doing it because we want to support our community and we're there with you. But there's no extra benefit to us providing the vaccines. It's not like anyone's giving us money to do this. So the hospital is upstaffing, paying for the overtime and such like that, really because we're here for our community. And we just ask for your patience while we're developing and growing our program. We didn't get our first vaccine sent to us until the end of December. And here we are 3 weeks later, and we're already at a point where we've gone from healthcare inside the hospital, building that program, to now vaccinating the community. Over the weekend, we were able to successfully vaccinate 140 people. And of that, we even had patients that were no-showing for the vaccine appointment, which puts us in a predicament with the potential for vaccine loss. So then we're now scrambling to go ahead and get someone in that appointment within 15, 20 minutes because we have the potential vaccine loss. There's some other logistical things with...
Before you go too far, Josh, I think that's really important to hit on, is the amount of no-shows. People make an appointment, don't show up, or maybe they make an appointment for 2 people in the family to come and only one shows up. And this isn't like the standard flu shot.
Yeah.
This is something that is time sensitive. So once you crack the seal on a vial, you've got to it can only go to a certain amount of people. And if you've got them scheduled, you're not over scheduling.
Right. I mean, we really can't overschedule and say, okay, we're going to go ahead and do this. And our scheduling too, and this is something that we've had some conversations with patients on the phone about, is why I want to schedule 3 weeks out. Unfortunately, we don't know what our supply is going to be for next week. We just recently had Kern County say, hey, we have about 7,000 vaccine doses that we are going to have to put in reserve right now because they were some of those tempered, the 041 lot number.
Mm-hmm.
We don't use any of those lot numbers. Ours are 025, 027 right now. But at the same time, there could be a potential where we have a certain lot number that gets pulled back because they need to watch it. So when we're looking at scheduling, while we like to say, hey, we're going to schedule 6 months out, let's go ahead and make a plan, we really are being told by the state to go week by week and only schedule 1 to 2 weeks out, because we don't know what our availability of vaccines are going to be and how they move tiers. So they can say, Tehachapi, you're going to be allocated for 2,000, but they may pull that back and say, well, we need to redistribute because this area needs some more. So patience is the number one word that we ask for when this is all growing and evolving, because it's really day by day, minute by minute, that we're getting emails. Okay, you can use this vaccine. You can't use this vaccine. We didn't get our shipment in on this time from the county or from the state, and we're now going to be using this dose instead. So there's so many moving parts, and I greatly appreciate the community. We've had a lot of outpouring of support, people asking to volunteer to help. There are certain HIPAA things that we have to work through, but we are here to serve you, and just rest assured we're doing everything we can to ramp up our capacity to do more vaccinations per day, and then also work on a 7-day-a-week schedule.
I think everybody should know by now that anything really related with COVID-19 is a fluid situation. I mean, let's be honest, look what we've done. I mean, we're almost at the 1-year anniversary of 14 days to slow the spread. I mean, obviously everything, whether it's a plan to stop a surge, whether it's a plan, all these plans, nothing that started with COVID-19 is the way it looked back in March of 2020, just because it's changed. And so the same goes for vaccination rollout plans. I mean, testing went through this issue as well. Now vaccine rollout plans, like it's not going to look the same. There's no perfect answer right away. It's going to take a little time to just sort of develop best practices and then give it a month or two. I think maybe everybody, including Adventist Health, will probably have a much better, better way to do it. But private healthcare providers are having the same struggles right now, trying to get their plans in place for their clinics, either in Tehachapi or other areas. So it's going to be a fluid situation like everything else that's been related to COVID-19.
It really is. And we would love to offer the vaccines in a different format, but because of logistics, we do have to schedule appointments. Kern County Public Health has actually asked us not to go ahead and do any form of walk-up clinics. There is some fear if we do a walk-up clinic of an onslaught of people in the safety and security, but also one of their statements is you shouldn't get COVID-19 by waiting in line to get the COVID-19 vaccine.
Yeah, that'd be kind of ironic.
Which is why we've moved to a curbside type service. It's all drive-through. You'll get instructions on what your appointment time is. You get to come through, drive through. You'll park. We come to your car, and we even have the parking spaces spaced out so that you're not sitting right next to somebody else, to go ahead and continue to promote that social distancing. We wear masks. We ask you to wear masks so that we don't have that transmission if anyone potentially is infected, and to protect our staff. We've done so much work to make sure we're protecting the community in this case.
Yeah, you also are doing the testing still as well, right? You've got the vaccination is ramping up, but people still are being tested.
Correct. So we're still in a partnership with Kern County through the end of March, March 31st, that we're still doing our COVID-19 testing Monday through Thursday from 10 a.m. to 2 p.m. We've actually doubled our capacity to the point that we're now doing 100 up to 100 swabs a day. And even with that, when we have people who are frustrated that they aren't getting in, I think yesterday we had something like 22 no-shows for their COVID-19 swabs. So we had 82 scheduled and only 60 people showed up. Still working through that. And those are, while people are getting, we're asking for the patients, and while we work through this, that person that no-showed took somebody else's spot that really wanted it.
Right. And that's something we definitely want to hit home. If you sign up to do it,
yeah.
Or let them know. They can call. Now, are they calling the same number if they're going to cancel? Say, hey, they've had a change of heart. They don't want the vaccine, or, they're not going to test, or they're going to need to cancel. What's that process for them?
Yes, it would be on the same line. And when we go to check the voicemails, we make notations. They want a test. They want a vaccine. If they say on the voicemail, I have an appointment today, I need to cancel, we immediately take care of that and resolve it so that we can cancel and open up that appointment. It's just like if people were to call and say, I need to cancel my vaccine for today, I've had to change my health condition or whatnot, we check the voicemail 4 to 5 times a day. So while we may not be able to call you back right away, we're able to at least document, oh, this person's going to cancel. Bam, we're going to open up the next spot. Mm-hmm. So we are working through this in a fluid situation. Right now, we have a team of 5 people that are working the phones and taking care of the online appointment reservations.
Yeah, I think that the rule of thumb is to probably treat whatever appointment, whether it's a test or a vaccination, treat it like you got an appointment at the DMV. You don't want to miss it.
Right. It's gold.
It's gold, right? You don't want to miss it. And yeah, you're inconveniencing that's always been a push, right, for COVID-19. Well, I'm doing this for somebody else. Okay, well, the same thing goes for your vaccination or your testing. Don't eat somebody else's spot up because you felt like you'd rather just go grocery shopping for the day, and you'll figure it out later. Like, it's very important, because once that vial is cracked and there's 10 shots, it's got to be done within a certain amount of time, or the vaccine goes bad. And the last thing you want to do is not only miss an appointment, but possibly take a shot away, and they've got to throw a vaccine away because they weren't able to give that last one out of that vial. It's super important at this point.
And it's interesting too. So as we go to move into this weekend coming up, there's the potential for snow and rain, right? Our staff, we had conversations. Our staff is willing to stand in the 30-degree weather and give shots to patients that need it. While we would normally cancel it for safety and security concerns, we're going to work on how we can modify it, but we're going to have to keep the vaccines inside, because if they're outside, they have the potential of freezing because the weather's so cold. But think about this, that the staff is so dedicated that I will stand outside when it's 37 degrees with our wind blowing and get soaked to serve the community.
Well, and also think how, and people in Tehachapi, you need to understand a couple things. We point this out a lot with Adventist Health, how fortunate we are to have Adventist Health. Whether you're just talking about the new hospital facility that opened a couple years ago, right? Adventist Health came in, saved that project, and from, because it was in trouble under the guise of the Tehachapi Valley Healthcare District. They had trouble finishing the project. Adventist Health came in as the operator and got the hospital open. Number one. Obviously, now we've raised the profile for healthcare, whether it's surgeries, just your appointments, ER, medevac capabilities, stuff we never had before. Okay, there's that as well. And then you look at this: to have a vaccination site in a community of this size, there's people are calling in from other communities and making appointments, and that's just the way healthcare works, right? You don't turn somebody down because you're not from Tehachapi. I'm sorry, I can't take you. But there are people in larger communities and larger cities calling and coming in here to Tehachapi to get this, because we have this service available. So you might not be as quick as you would like, but the fact that this is on your doorstep, if this were to happen 5 years ago, if COVID-19 would have been, COVID-14, and we'd have been in really, really bad shape in Tehachapi. So don't let that kind of get lost on how important it is that, obviously, like Josh points out, these people are doing this job in really, really bad situations sometimes, and tough, challenging circumstances, but that it's actually here. I mean, it's not perfect. It's not ever going to be, but wow, if this was 5 years ago, we would have been in a world of hurt, and you'd be having to go to Bakersfield or somewhere else to even get this type of service.
That's right. There's another way besides making the phone call for people to register to get the vaccination. Can we talk about that a little bit?
It's actually a really good system. If you go to the kernpublichealth.com, and you log in, you can look for COVID-19 vaccination sites throughout the county. So if you are thinking that it may be taking a little bit longer for us to go ahead and get your appointment, there are other sites that you can look for, and they have contact information. But when you register online, you put in all your information, we're able to see it right away and then start to work through scheduling. Some of the barriers that we do have when people are calling on our line, they think that they have really good cell phone service, but we hear every other word that they're saying. Some people forget to leave their cell phone number, so we can't call them back. Or when we do call them back, we need to verify information and get their email to send them out an appointment confirmation, and they don't answer the phone when we call back. And I get it. We all get a bunch of telemarketers calling, so you're like, oh, there's an odd number calling me, so you don't answer. Well, then that sets off, now we're playing phone tag with somebody. Online registration is much easier. We get to see your information. We get to go ahead and see your email, so we can send you an email confirmation that this is your appointment time and get you scheduled. Something we are working on in the online world too, that I'm going to be testing out right after this call in about 10 minutes, is an online scheduling platform. So we can just put up the appointments and have people register for them. So we are working through that to make it faster and more efficient for people to schedule appointments with us. But we're still within the same constraints of our vaccine supply changes day to day, and we're really under the constraint of the state of California.
And it's that fluid point. I mean, you're trying to do things to make your business better and do it more efficiently, and it may work, it might not, and then you'll go from there. I mean, that's that understanding people got to realize, like, this continues to be fluid, and it'll get improved as it's able to be improved as efficiently as possible.
We want people to go to kernpublichealth.com, and then in the middle of the screen, it says find a COVID-19 vaccination location. Click on that button. You'll see a map, and then there's little dots around Kern County that show these vaccination locations. So Adventist Health Tehachapi Valley is one of those dots in Tehachapi. click on that dot, and then there is a screen that you can now open up the application, and it's really easy to fill out.
Yeah.
It's an easy process.
It is really easy, and you can even do it from your phone on a smartphone and register that way. We've had patients who are 83, 90 years old that have been able to do it on their smartphone.
And if people are wondering where they fit in the tiers and when it's their time, there are the guidelines are still posted up on the Kern County Public Health website as well, right? So if they have a question of, do I fit into this tier, they can go there to answer that question themselves.
Right. I appreciate you saying that there are the tiers listed. We do have to comply with what Kern County Public Health has set as our public health agency in our partnership. If we step out of tiers, we risk actually losing the ability to give vaccines to patients. One of the things that we've noticed is people are putting online that they work in a home health care setting or a specialty clinic. Kern County Public Health has not allowed us to give vaccines to veterinary clinics. While there are specialty clinics, they are not considered the specialty clinic for Kern County Public Health. And if you're an in-home healthcare worker, you have to be credentialed and licensed to comply with what Kern County Public Health has asked us.
Okay. Interesting. And all the information's there. We just have to take the time to go ahead and read it.
Yeah.
And not create a log jam of calling and tying up the phone system until you're ready. And I'm going to go out on a limb here, Josh. It would probably make life a little easier if people did use that online system to set up that appointment. It would alleviate maybe some of the pressure that the phones getting backed up was what you're seeing.
You know, that is very true. Online is a easier format. We had our second day that it was announced that we could go 65 and older. Our voicemail system actually crashed because we had so many people calling. At one point in time, there was like 400 separate calls coming into the system. Mm-hmm. And it's difficult to work through that.
If we've got anyone that's listening, or you have maybe a parent that reaches that criteria right now at 65 and over.
Help them out.
Yeah, you can help them out and fill it out with them.
Yeah.
So that way they can get it, and and that might give them a little peace of mind if they're worried about getting it, and they might be maybe technology challenged.
Yeah.
You know, I am, and I'm not in that 65. I'm technology challenged, but I'm not at that 65 level. So I might have to get my son to help me out and populate when it's time. But
I don't think you'll have that problem, Key.
Yeah, says the guy. He's putting together a podcast. He's trying to say he's technologically challenged.
Well,
yeah. Don't buy it.
I just want to relate to some people that might be listening out there. Let them know they're not alone.
Right.
But it's okay for family to help family.
Yeah.
You know.
Yes.
Now, when people come, or they're showing their ID to prove that that's who they are, so you can't register as someone else.
Yeah, we are verifying ID, and those that are in healthcare, we do communicate that you're going to have to provide proof of healthcare status. So if you're a firefighter, EMT, etc., we just ask for ID. Those that work in a lab, so we do have a process to validate that, because we are required by Kern County to do so.
Yeah, so you're not going to be able to pretend to be someone else,
right?
And get that jump in line. They are verifications. So
the good thing about over 65 and older, it's pretty easy to verify that with your date of birth on an ID.
Yeah, absolutely.
It is. So, Josh, anything else that we need to touch base on, or that you'd like to share? Or let me ask you this, and we didn't talk about this beforehand. Do you have anyone that's where you've just kind of walked away and say, hey, this is the reason why we're doing it? Have you had any kind of positive interactions with members of the community that just said, thank you?
You know, we have, and those are, it really helps continue to motivate our team, and it's really why we do it. Every patient who came in over the weekend thanked us, said they're glad that they can do it here in Tehachapi, and they said that our system was actually much easier than other systems where they're trying to schedule to get an appointment and stuff like that. One person who lives in Fraser Park who works IT said that it was one of the easiest online registration systems that he saw, and he was willing to drive from Fraser Park to Tehachapi because it was the easiest process.
Well, that speaks a lot right there, because that's a 90-minute drive for somebody. And, if they were able to do that, and they work in that field,
and he said there was no other option. There weren't a lot of other options near where he lives, to go ahead and get that vaccine. So we are pretty spoiled in Tehachapi that we can do that.
So besides with this that's going on, anything going on at the hospital that we can talk about, or we want to share anything that, are you guys just trying to get through this pandemic? Is that kind of where the healthcare industry is right now. It's like, man, we just got to get to the summertime.
No, we're always focused on the future, because while we're here today serving, what does tomorrow look like? What is a year from now? What do we need to do? We're constantly doing our health survey of what the community needs are, especially as the community is growing, right? What services do we need to bring? We are working on a groundbreaking modified ceremony, since we really can't have people there, in the beginning of March for our imaging pavilion. We're going to now have a enclosed MRI attached to the hospital, along with a upgraded CT scanner. Christina Scribner has worked diligently as the director of philanthropy on raising the funds. Adventist Health came in with the other half to match so that we could go ahead and build it. We were supposed to kick off a little bit earlier in the year, but with COVID, the state has just gone ahead with our regulations and delayed it a little bit. But we are going to be doing the groundbreaking sometime in the beginning of March as a tentative date, so that we can have it open by the end of the year, so we can offer those services to the community. We are looking at expanding our surgery services. A couple years ago, we never had the ability to have total hip and knee and joint replacements here. In November, we did over 30 different orthopedic surgeries at our hospital. You know, having the ability, last year in July 5th, we actually became accredited as a acute care hospital. So we have the same designation as Bakersfield, Adventist Bakersfield, or even Antelope Valley Hospital when it comes to that. And it's just constantly, what extra surgical services can we bring on so we don't have to transfer patients? What telemedicine services can we bring on? We were able to secure a contract with cardiologists. So now we can keep more cardiac patients in our hospital instead of sending them out of the area. We still do have some limitations when it comes to certain insurance companies not wanting to admit in our hospital, but we're trying to work through that contractually so we can serve more patients. When we look at physical therapy, we've been able to bring on a pelvic floor PT specialist. There's only one pelvic floor PT specialist in something like 120 square miles, and we have it here in our town. We also have the ability, we brought on occupational therapy and are bringing in more speech therapy into our hospital. So we're constantly looking at ways, what does the community need? What can we bring to them?
This is all the stuff. Yeah, this is all the stuff I was talking about, right? This is the point I was making earlier. You know, let's not gripe about the fact you didn't get a phone message returned quick enough when you've got all this stuff available at your fingertips. And again, 5 years ago, this was a pipe dream. This would have never happened. You would have been in Bakersfield or the Antelope Valley for every one of those things Josh talked about. That's the amazing part of what Adventist Health has done. And then, you know, COVID-19 gets thrown in there, and they got to do that as well. So, I mean, job well done, Josh, with you and your team and the entire group over there. Continue to get better, not just happy that the doors are open, but what else can we do to keep people locally and keep them getting service up here? I mean, that's huge. I mean, that's part of my job is when it comes to, you know, economic development. What can you offer up here so you don't have to go spend money elsewhere? I think the same exact thing applies for healthcare. You know, how much can you offer up here so they don't have to go or have a family member in a hospital 45 minutes away when they could be 5 minutes away? So, you know, job well done, and thanks for continuing to make everything better up there.
I appreciate that. And thank you for your time and inviting me on the show. Look forward to doing this again in the future.
Oh, heck yeah, Josh. So let's just recap again. So there's two ways that people can get the vaccination if you're in the correct tier. We're encouraging you to go to kernpublichealth.com, then click on the Find a COVID-19 vaccination location. Then you'll see the Tehachapi area. There'll be one of three dots, and that one dot you want to click on is the Adventist Health Tehachapi Valley location. And when you open that hit that dot, then the online form that you can complete is there. Once you hit enter or submit, it'll get into the system.
Right.
And it saves a phone call. Or you can call and be one of the 600 people that call each day at 661-771-8400. But expect there's going to be time delay in getting that call returned and then coordinating that schedule. So we encourage you to go to the online, but if you don't have the online capability, the phone number's there, but it's just going to take some time, and be patient.
That is the word of the day.
Josh, thanks so much for the time. We really appreciate it. You know, and all the staff there, just let them know that we here at the city, we really appreciate everything that's going on at the hospital. And, you know, it's making us a much better place to live. All the staff there at the hospital are a key part of that. So thank you very much.
Hey, no, thank you very much.
All right, Corey, the conversation with Josh Pierce from Adventist Health Tehachapi Valley, informative, not only with what's going on here with COVID-19, their plans, their vision for the future here in the community, it really opened my eyes to the things that they're doing. I know they've been doing the testing, but they're deep in the vaccination that is constantly evolving, how fluid that situation is, rules, the quantity of vaccine that's available, how patients can call to get scheduled.
Yeah.
And they're, just trotting right through it and trying to make it as easy as possible for people, but trying to, I guess, get the information to, understand and be patient.
Yeah, and there's a lot. I mean, the call volume is crazy, as we pointed out, and then it's not just calls from this area, right? Because it calls from all over the place. So you just got to be patient. When you call once, you're in line. Don't call 15 times a day.
Right.
You're really just muddying up the waters. And if you make an appointment, you get an appointment, keep it. Or if you can't or change your mind, then call and physically cancel it. Somebody else can take that, because it's so important. Once those vaccine vials, are open, they've got to be used, and you don't prevent somebody else from being able to get that vaccination.
Yeah. So let's share the information for the folks again. If you'd like to make the phone call and be patient, because it'll take them time to get back to you, it's 661-771-8400. But we encourage you to go to the Kern County Public Health website, and that is, their website is
KernPublicHealth.com.
And then click on Find a COVID-19 vaccination location. That's right in the middle of the page. Find the Tehachapi locations, pick the dot that's Adventist Health Tehachapi Valley, and then fill out the form.
Yeah.
And once you submit it, it gets right into the system.
Right, and then they'll get back to you and get you scheduled when they can, and they can't schedule 6 months out because the state's not allowing them to do that right now. So, again, only a limited amount of spots available, and limited amount of time to do so, and then just limited capacity to handle the influx of calls and requests they're getting at this point.
And a limited number of vaccines.
Yeah. I mean, they don't have a whole allotment. Yeah, they don't have a giant allotment yet. So, and that will come. I mean, just, again, be patient. This is going to take a few months to sort of roll out. And when more vaccine product becomes available and the process gets more streamlined, it'll be a little bit easier.
Yeah, and if you'd like to find out what tier you're in, your eligibility, you can find that on the Kern Public Health website also.
Correct. The
information's there. Hey, other things going on in the community, Tehachapi Community Theater. They've got, in February, they're going to have, I think it's a virtual play.
Mm-hmm. Yeah.
So that's kind of cool,
yeah.
As they've kind of evolved to try and figure out what they can do. And there's people that are just wanting to get involved in their theatrical, activities. Yeah. They've figured out, hey, let's do it through the website.
Right. Might as well give it a shot, see how it works.
Yeah. So I think I'm going to check it out. I think it starts in February, and I forgot the name of the play, but it's like, hey, you know what? I appreciate the fact that our local community wants to provide entertainment. Yeah. They're doing something that they have passion for, and they're going to go ahead and put it on their own TCT.
Stage.
On stage.
Yep.
.com, and you can go ahead and check it out. And then, of course, they're always looking for help as well. But I thought that was kind of neat. Anything else we have coming up? Anything else? I know that, we broke ground on a new Valley Strong.
Yeah, Valley Strong is moving along. With their facility, they're building basically the lower edge of the Walmart out parcels. So right along Valley Boulevard, and that's they're pretty much doing the entire parking area down low, along with their Valley Strong Bank, which is going to be beautiful. If you've seen what they build with formerly Kern Schools Federal Credit Union, now Valley Strong Credit Union, if you know what their buildings look like elsewhere in places like Bakersfield, they build a beautiful building, and they've got a great plan for Tehachapi. It's going to be awesome right there. And they're also developing another pad that they own for something. I don't know what it is yet. No, nobody does, because they haven't found a tenant, but they're actively looking for somebody to buy that piece of land, for some, most likely the restaurant category, just because it is kind of a drive-through convenient pad. So we'll see, but they're going to build that out, which will be really nice to kind of complete, for the most part, some of those Walmart out parcels.
Yeah, Panda went in so fast.
Yeah.
I mean, it was kind of like you turned your head and, wow, they've got
6
walls
months.
up. Wow.
Yeah.
They're serving food.
Dirt to doorknob. It was about 6 months, so pretty impressive that they were able to pull that off, yeah.
And then the NYC Deli is open, and I've eaten there. Really good.
Yeah.
Love that boar's head meat.
Yeah, that's awesome.
And then this year we also the tacos El Superior. I mean, we've seen some growth, in that food industry.
Yeah.
And there's a lot of places that are hiring. It's a good time to be in Tehachapi right now.
And even some of the established restaurants. I mean, the folks at Red House Barbecue and, Mono Lujan and his wife, Meme, they own the shed. They used it as a restaurant for a while. Then it became an event place and special events. Now they've reopened it with a Hawaiian menu of to-go meals. And I had it the other night. It's phenomenal. It is so good. And it's really easy to call, place your order, pick it up. And it's really cool. He's also got they're full plant-based containers, recycled material. They're the best to-go containers I've had yet. Everybody's struggling with trying to find that right to-go container.
Yeah.
Because grease eats styrofoam and certain things don't travel. These probably cost more as a restaurant owner to have, but they're great and they keep the food warm and doesn't get weird and soggy. And it was excellent food. They're open. I think it's Wednesday through Saturday, and they run the soup kitchen there on Sunday. So Wednesday through Saturday, lunch and dinner to go there at the Shed, the new Hawaiian menu. It's pretty awesome.
Excellent. I got to check that out.
Yeah, really good.
Well, folks, if you've got anything you'd like us to talk about, a topic or an idea, give us a shout out at media@TehachapiCityHall.com. We'd love to hear from you. It's media@TehachapiCityHall.com. We'll take a look, and this is how some of our episodes have been created, is by your input, and that's what we want. Coming up in a future episode, we're going to be talking to folks from Gilbert, Arizona, the digital communications director, and what they do in Gilbert to talk to their community. So we'll look and see the things that we're doing, how we can enhance that, and what they've done successfully, because they're very well known for the things that they do. Also, we're going to be talking with Michelle Corson from Kern County Public Health. We're going to do another, from the county's point of view, things that are going on with the public health here in the county and COVID-19. So we've got some great topics, and also Caltrans. We're going to have Caltrans on it. We're going to talk about the way they communicate to the public. So if they've got an incident, if you want to get real-time information from Caltrans, how you can do that.
And we might actually have some winter weather coming up, so that'll probably be a very timely podcast. It looks like we're finally going to get that Tehachapi winter.
Yeah, exactly. So those are some of the things that we're looking forward to here in the coming weeks. And again, reach out to us, media@TehachapiCityHall.com. We appreciate your time. Thank you for listening. Make sure you subscribe and tell friends about Tehachapod.
Tehachapod is a conversation about Tehachapi designed for the people who live here or who would like to know more about this mountaintop community. If you have a question you would like answered, email media@TehachapiCityHall.com. We will try to answer it on a future episode of Tehachapod.